Well, hello and welcome to all of our Gold viewers here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. Well, it's a great day here at Gold Learning because we are talking about our upcoming Gold Obstetrics Online Conference 2020. And of course, sitting with me today, I have Dr. Divya Parikh. She is going to be speaking as part of our add-on package here, and the add on package is Breastfeeding Medicine, Advancing Your Level of Care. Welcome, Divya. It's great to have you back here at Gold Learning.
Thank you so much. I'm excited to be here.
Yeah, it just seems like a hot minute since we've been here, of course. And I know it was great to have you be part of our Gold Learning family already. And it was a perfect fit to have you come back. The topic that you're talking on, as I smile ear to ear, because I know I can, I'm always trying to resolve these problems. And I know many of you will relate to this, but update on the evaluation and management of low milk supply. This is an area that is definitely plagues a lot of our families. And just when we feel like we have, sorted it out, it seems to come back again. So I will talk about the topic in just a moment. But first of all, let's get some updates on you and see what's happening in your life. So perhaps once again, for those listening in, you can just let us know where you are in the world and what's happening in your daily practice right now.
Yeah. Yeah, so on my end, yeah, it's interesting that you asked that, and especially now with all of our transitions happening with the pandemic. Our office, so I work in a primary care pediatric setting in Columbus, Ohio. Um, we had quite a lot of changes in our office adapting to the new safety policies to keep the pandemic at bay.
Yeah.
And now we're getting busy again, which is a good
Mhm.
thing. And lactation has remained a part of my practice and it's been building, which is very nice. That's one of my goals with this practice, to make a breastfeeding medicine presence.
Mm,
Um, and so I've noticed, one thing I'm pleased about at my practice is that my referrals are growing a little bit, and
mm.
I'm helping some moms with a few atypical problems as well as some common problems. So it's nice to have that in the mix. Um, yeah, and on my end, on a personal level, my children, I've got two children. I've got a 5-year-old daughter and a 2-year-old son, and my 5-year-old is entering the world of remote school. So she's in remote kindergarten, which is it's an experience. Yeah, she's I'm fortunate that she's taken to it so well and that she's adventurous. So I
Mhm.
think she's enjoying it, and I am almost positive she is learning something. Yeah, the teachers are doing a great
Good.
job. So, yeah.
Yeah, it is very interesting, and I know since we last had you here at Gold, things have changed quite a bit. But we've all become sort of adaptable, and it is hard. I mean, I would say that there's lots of things that we're still adapting to, but we are seeing, of course, a lot of families have children online education now, and it's a little bit different. But I'm very grateful for so many folks out there who are working hard to make that possible for our families as we move forward in the pandemic. So it's good. We're in a good place that we have the technology. We're always very grateful, of course, at Gold Learning to be able to provide this education online and have that touch point for educators. And of course, this has just given a bigger lens in connecting folks internationally and around the world, including yourself. So let's jump into a little bit more about why this topic. So I want to know from you, as me, like this struck me right away. Low milk supply comes up so many times, and it seems like you can learn so much about it, but then oh man, I just had a case recently, and it took kind of a bit of a turn. Where I thought things were going really well. So um, does that happen for you too, Divya? Like, why did you gravitate towards this particular subject?
I chose this subject because I feel that it's one of the most common things that as breastfeeding medicine providers we address,
Mm,
and particularly in the obstetrics setting. This is Gold Obstetrics, so having that knowledge base of what to do when a mother comes to you with these problems, because I feel that. there's so many places for moms to go, and sometimes they don't know which one they should be going to. And
Hmm.
having at least a broad knowledge base across multiple different areas, obstetrics, pediatrics, outpatient lactation, um, would be really beneficial to have. Mhm.
Yeah, absolutely. Yeah,
Yeah.
I love the idea of more and more physicians opening their practices, perhaps becoming lactation professionals like yourself. It really does lend to the community. And there, I mean, there are enough there are enough parents around. The demand is high, and we always do hear about families who weren't successful. And a lot of the time it's because they didn't connect with the right people. So we know
Mhm.
we're still lacking in resources, and that's perhaps why we need to keep talking about this as well. Are you going to be talking about some of the all the common things and some of what other challenges? Give us a little inside scoop here to what we're going to be hearing in this presentation.
Yeah, so I think we're gonna go. My goal with this was to provide a good base of knowledge. So we're going to talk about some of the common things, how to put it all together. I also wanted to provide an understanding of how a milk supply is established and where those things can go wrong. So
Hmm.
there's a little bit of basic science,
Sure.
and a few pathways, but I won't make it too tricky. And I wanted to hit on a few uncommon things too. I came across some research on um, parents who have undergone assistive reproductive technology, and what does that mean for lactation outcome? Is there any research out there regarding this scenario? I also touched on history of like breast surgery and even breast radiation,
Mm,
because now we're having survivors of Hodgkin lymphoma go on to have children,
mhm.
which is a miraculous thing, but sometimes that can have implications for breastfeeding, and we need to know about that.
Excellent. Good. So it sounds
Mhm.
like we're going to get a good overview of all the things that we can look at or dive into if we need to, based on what the client sort of presents to us, which, of course, is always very important. Lastly, wrapping up, can you tell me, are you still getting clients sort of in your office on a regular? You're doing face-to-face consults now? But with
Mhm.
these clients presenting to you, are you seeing more problems right now, Divya? Because I we have seen some concern that folks are staying home longer and maybe not reaching out for support. And you mentioned earlier that you're starting to see things pick up. Any concerns for you in the field right now?
One thing that I tried to do, and I still do, I provided telemedicine lactation
Mm,
um, during the lockdown. So the location where I provide care, fortunately, there were some people that knew that that was an option, especially when they were afraid to come out and about and come to a doctor's
sure.
office. So that I think helped. I did quite a few televisit lactations, and I feel that where we are right now, families are a little bit more comfortable coming out and about. Um, I have seen some negative consequences, I think, just with um, infection control concerns and babies born to COVID positive mothers, and that,
Right.
even if they weren't separated at the hospital, there's a little bit of more caution at the home, and so
Yeah.
there might be a little bit less direct breastfeeding, which might lead to latch issues. And so I've been
Hmm.
seeing that we have to do a little bit of catch up work, although for the most part, I've been able to get people on track.
Yeah, well, it's good to hear.
Mhm.
I mean, I think acknowledging that we are there is a little bit of a dip going on is really important, because I think this again lends to our sort of low milk supply and what we can do and how we can recover from it and what we should be looking at as well. So, yeah, it sort of all rolls into one. So, thank you so much. It's going to be so good to have you here at Gold Obstetrics once again as part of our add-on package. And again, I'll just remind folks, breastfeeding medicine, advancing your level of care. For all of you listening in, of course, this will take everything to a whole new level. And we're looking forward, of course, to sharing this with you as well. If you do have any comments or questions, you can pop them in below right now and just check in with us. We'll look forward to to answering those questions and comments for you. But you can find this package and, of course, a full conference all online at goldobstetrics.com, where you can register for the full conference. We'll look forward to seeing you on November 9th for our opening keynote, where you're all welcome to come to our free opening keynote as well with Dr. Nathan Riley as well. We'll look forward to seeing you there. Well, thank you so much, Divya. Parikh, it's been great having you here once again and sitting down and chatting with you.
Thank you so much.
And thank you once again to all of you, our viewers. It's always wonderful to have you here, and we'll talk to you all very soon. Bye bye for now, everyone.